Welcome to the Road Homes One by One question and answer session. My name is Michelle Flynn, and I will be answering your questions. Just checking with my team. I believe that I am now live and have the opportunity to answer your questions this morning. Again, my name is Michelle Flynn, and I serve as Executive Director at the Road Home. And I appreciate this opportunity. Thanks to all of you for taking part in our one by one fundraising event over this past week. You've seen videos every morning at 9 o'clock from our different staff members and board members telling you about the work that we're doing. And this morning is an opportunity to provide you with answers to some of the questions you have. So I do have some questions that we have collected over the last few days. You can also post questions now, and I will attempt to get to as many as I can. Again, thank you for joining. I am currently at the Men's Resource Center in South Salt Lake, one of the resource centers operated by the Road Home. We serve single men who are experiencing homelessness in this facility, along with many of our partners working to get people back into housing as quickly as possible. I will say that we had a fire drill earlier this morning, so if that happens again, we might have to pause the live feed so I can go outside and conform with the fire rules as we're testing our system. But in the meantime, I'm here. You'll see some beautiful plants behind me. Some of my teammates are keeping in good order, and out to the window behind me is the Jordan River. So we are in a beautiful location out here in this building, and I will talk about what we do here at the Men's Resource Center as well as our other programs. But let me start first with one of the overall questions that we receive quite commonly, and that is generally, what is the main reason someone is homeless? That's something that we get asked a lot. One of our donors, Stephen, asked that question over this last week. Thank you for your donation as well. And truly, there's a lot of pieces that come into someone experiencing homelessness. People are individuals, and they have different things that they bring to the table, different strengths, different areas where they need more support. But really, the main reason is we just do not have enough affordable housing and access to that affordable housing. Rental assistance that might be needed. There is a large gap between people who make very low incomes and what it takes to rent an apartment or a home in our community here in Salt Lake, let alone other communities. We've seen this disparity increase over the last few years in large cities. It's particularly troubling if you watch the news about what's happening in San Francisco and other large cities. You can see that growth there in unsheltered homelessness has been tremendous. Here in Utah, we have a very strong collaboration with our state, with Salt Lake County and the cities in Salt Lake County, and we work hard to ensure that we really can find a place for everybody that needs a place to come in, and we've been able to keep the number of people experiencing unsheltered homelessness down. Over this last year, we've transitioned to the new resource centers, this one being one of them that we opened here in November for single men, and 2 other new facilities in downtown Salt Lake, and closed down the large downtown resource center shelter that we had been operating. The Road Home's been operating since 1988 down on Rio Grande Street. So what we see, I mean, you often hear people say things like, I'm at 1 paycheck or 2 paychecks away from homelessness. And I can understand where they're coming from. It might be that they have no savings. A lot of people in our community have very, very little savings to fall back on. But people who truly end up experiencing homelessness, people who have nowhere else to go but a homeless shelter or resource center facility, are those individuals and families that have lost income. They often have a preemptive crisis that leads to them coming in for help. Often things like credit card debt, no credit history, so not able to get any kind of assistance in that way when they lose some income. Things like a health crisis that for a family that's uninsured or has high payments can definitely spiral into homelessness because you're going to prioritize the health of your family and paying for those things first. And often the paying your rent isn't that top priority when you're taking care of your family. And so these are individuals and families who most of the time have expired all of those support systems. Perhaps their own family and friends are not able to take them in. They are not able to help. They've maybe stayed with family and friends before, and those family and friends are stretching their own resources or are not allowed to have more people in their unit. And that's when families and individuals show up at our front door. Now, there are other reasons as well, which we'll get into with a couple of more questions that can add to that. But really, I will say this consistently, is the lack of affordable housing in our community and those connections to affordable housing. We are working closely with all of our partners, but this is a systemic issue. And it's important that we are here for when people need us. But working along with the Salt Lake Valley Coalition to End Homelessness and other partners in our community, we are really working first to reduce the number of families and individuals who experience homelessness, and doing that by prevention and connection with resources when people are struggling, as well as diversion right at the front door of the facilities. And then once people become homeless, we want them to be homeless for as short a time as possible, and really focus on housing and housing conversations and understanding how this family or individual can be most stable. And then our staff scour the community for any affordable apartments, any rentals out there, work closely with our great friends at the housing authorities to connect with resources that are available through those entities, senior housing, veteran housing programs, anything that we can to get those connections to people to end their homelessness as soon as possible and get them into a permanent housing situation. So there's a long answer to why people become homeless. What role does mental health play in homelessness? That was an anonymous question from one of our donors. And also questions around substance use disorders have come up, and there is a role that mental health plays, particularly for people who have serious mental health issues, whose families aren't able to take care of them, individuals who don't like to engage with others, individuals who have been just lacking in those resources of a place to stay with no income and no real ability to hold down a job due to their mental health issues. Often people who are unsheltered for long periods of time have mental health issues. They have not been able to connect with resources. There are not facilities that are able to have all of the supports that they need, perhaps. A homeless shelter is not the best place for someone with serious mental health issues. They really need a rich array of supports. And so we work hard with our partners at Volunteers of America who lead street outreach, and we bring mental health resources as we can into these new resource centers and really help connect those folks who need that help with the right program, the right counselors that can support them to help end their homelessness, and then continue that support to help with stability in housing, which is so important. I think most of the work that we do is really knowing and understanding all the resources that are in the community, and then meeting with each individual person, understanding what their individual needs are, and helping them get connected to those resources in the community. And there are many wonderful programs out there that we want to make sure we can get people connected to, and that they can continue to work with that individual or family once they're housed to help them keep their housing. Okay, next question. How can I help the children? So one of our donors, Karen, asked that question, and I appreciate that question. We are very focused this year, particularly. We are going to have a special focus on ending family and children homelessness. We operate the Midvale Family Resource Center. The Road Home has been operating that facility for many, many years, an old facility that, along with partners, Shelter the Homeless and others, we were able to rebuild and opened a new building a few years ago. That facility is the main resource center shelter for families who are experiencing homelessness. We work very closely with our partners in the domestic violence service provider community to make sure that families who have those kinds of safety needs get connected with those organizations. But other families end up coming to us down in Midvale, and we have space there for about 80 some families. We have been using, recently, we've been using motels as another option to keep families who are high risk of COVID-19, and I will talk a little bit more about that later. Out of the congregate facility down there, we have a rich array of amazing case managers. Our housing team is on site there, Utah Community Action, doing diversion services, incredible partnerships with the Canyon School District to ensure the children are connected with school immediately, after school programs at the school district, at the Boys and Girls Club. We feel very much part of the Midvale community. Our program is embraced by the mayor and the council, and Chief Thomas with the police precinct down there is incredibly important partners. The officers, homeless outreach officers that come on site and really help to provide safety to the families that are down in Midvale. So how can you help? We definitely have a list of needs on our website that talk about the different things that we are in need of in terms of in-kind items. We have a very robust volunteer program. Now that volunteer program's been on hold due to the health crisis the last while, but stay tuned to that. You can look and see all the different opportunities that we have and be ready to jump in when we are able to open again to volunteer opportunities. And right now, one of the things that our volunteers have been doing and done amazing well is to provide box dinners and meals and hot meals and things like that for the families down there, which they can just drop right off in a no contact way. And we can get those to our families and children down there. And so we stay tuned to what we do over this upcoming year. We're really going to focus on helping end child and family homelessness as quickly as possible. We know that children who experience homelessness every day that they're living in the homeless shelter and experiencing homelessness has an impact on them, has an impact on their school and how well they're doing with their peers. And so we're going to work really closely with our community this year to see what we can do to reduce family homelessness. Now, I've got a few more questions. Let's see. Is the homeless shelter safe? So we have done a lot of work, the Road Home, over the last few years with our partners to create a safe place. We know that we are a dedicated, caring, and compassionate group of people that do this work, and we want to help anyone who has a need for our services. But first and foremost, we need to have a safe place for people to come, because if they don't feel safe, they're not going to come in for the help that we can provide. Over the course of the last few years, we've had a lot of work done in building our partnerships with the law enforcement agencies, with the neighborhood communities that are around us in each of our facilities. We began a couple of years ago working very closely with the Department of Public Safety, with Utah Highway Patrol, who created some homeless resource officers in the downtown Rio Grande area. And we went through a huge learning process. As homeless service providers, we think very differently than law enforcement officers. And this was a new area for our law enforcement partners to become ingrained in as well. So together, we tried different things. We really listened to what each other was bringing to the table. We understood, even if we didn't always agree on every detail, we understood why a recommendation was being made. And together we developed a safety protocol that is now consistent in all the resource centers in our community. And that is a close partnership with law enforcement, on-site private security 24/7 at all of the resource centers. Those private security officers help with the intake, or help with the check-in of the facility. And when people come in the front door, they are able to first try and work with a diversion partner, Utah Community Action. And then if they do need to come in, We will meet with them and give them the lowdown on what to expect in the facility and how we're going to help them with housing. And then individuals get a place to store their belongings. They'll go through a check-in process where our team and our private security partners will do a bag search and have folks go through a metal detector to ensure that we don't have any prohibited items that are coming into the facility. Our staff are doing rounds throughout the facility on a regular basis. We are training our staff. We're training our staff on what to look for, on engaging with folks in a positive way so that they're talking to us and we're hearing when they're unsafe. We have multiple ways to get guest input from day to day with our staff, from a regular survey that we can do, town halls that we hold, written notes that people can submit to our management team. We know that we can get the best information from the people that are staying here. All of our facilities now are completely fenced and with a central and one entrance. And so we can make sure that everyone is coming in and getting checked in properly. We have weekly meetings with our law enforcement partners and private security. We have monthly meetings with our city officials, both in South Salt Lake and in Midvale. And we really know that communication is the best way to help keep people safe. So with all of that together, we have provided incredibly safe facilities throughout our system for people who are coming in need of shelter. Okay, I'm gonna pause and just take a little drink because I'm getting a little dry mouth. Okay, let's move on to a couple of questions that are more agency-wise. So one question from Lisa is, where does your funding come from? The Road Home operates, as I mentioned, the two resource centers, the Men's Resource Center in South Salt Lake, the Family Resource Center in Midvale. We also operate overflow shelter programs in the wintertime. And we have a robust housing program. So we have a housing team that meets with families and individuals in all of the resource centers. They will meet them wherever they are out on the streets. We have housing individuals staff members who work with veterans, families, single men and single women. And then we've also decided to fill a very narrow gap in the housing sphere. And that is that we operate rapid rehousing and permanent supportive housing programs. And so that includes facilities or projects like Palmer Court, which is 201 apartments for families and individuals who were formerly chronically homeless, as well as we manage rental assistance programs that help pay landlords throughout Salt Lake County and support individuals and families who are exiting homelessness for different periods of time, depending on what their needs are. Some of those programs have short-term support with some basic case management services, and our permanent supported scattered site programs have case management that will stay with that individual as long as they need, and that rental assistance will stay with that individual as long as they need. Those are the kind of programs that are so important to ending homelessness and really help us get folks who need that additional assistance into a housing situation with those intensive wraparound services, those permanent supportive housing programs where our team works with other partners in the community to continue to provide support for people as long as need be. So how does that tie to our funding? So there's a lot of different kinds of funding that we need to operate those programs. We have about 64% of our funding comes from government sources. Now this includes rental assistance. We manage about $3 million of rental assistance funding throughout the year. So that's money that passes through our agency to landlords to help individuals stay housed, as well as contracts that we competitively apply for from federal government, state government, county government, and local city governments. And we have a wide breadth of support, not just from South Salt Lake and Midvale, but also from Salt Lake City, funding from Sandy and West Jordan and others that have been there for many, many years to help us in the work that we do. The remainder of our fund comes from foundations, corporations and businesses. About 10% comes from individual contributions. And that is really the work that we're doing here, trying to build friends and build support in the community. We know that the work we do is partner driven to begin with. We can't end homelessness alone. And each day that our staff are out there working, right by their side are other partners and members of the community, and all of you that care so much to hear about what's going on and wanting to get involved. And so we thank you for that. Another related question is specifically, what does my money go toward? And so I gave you a little bit of an overview just now about about the different programs that it funds. Again, a lot of our facilities, we have staffed 24 hours a day, 7 days a week, and we have case management and housing outreach specialists, people who know all about helping veterans, others who specialize in family and the type of supports families need. So a lot of our budget outside of the rental assistance goes to pay for our staff. That's where the majority is in our program staffing budget. About 5.6% of our budget goes to administrative costs. Those are the overhead costs for our management team, our accounting teams, our human resources and information technology teams. And then about 3.3% of the funds that we receive go towards fundraising. So you can see the great majority of funding that we have goes directly to those programs where people are on the front lines helping members of our community every day to end their homelessness. Okay, I'm gonna look up, see where we're at with the questions. Part of that, what are your biggest needs? I'll talk a little bit here about the COVID-19 health crisis. Now, if you've been watching some of the news, you will have seen and understood that COVID-19, this coronavirus that we're experiencing, has a couple of really challenging aspects to it. And one is that it's highly contagious. And second is that people who are in high risk categories get much, much sicker. And so the people that we are serving who are experiencing homelessness are a vulnerable population. They probably have been living without a lot of health care for a very long period of time. And we, in our society, in our community, have chosen to create congregate shelter facilities to help folks who have nowhere else to go. So in those congregate facilities where we have 200 or 300 people a night in the facilities that we operate in our county, that is a very high risk atmosphere. COVID-19 has spread in nursing homes and jails and prisons, and the same in homeless shelters throughout the United States. So we are working hard with our partners. Salt Lake County COVID-19 command team under Deputy Mayor Aaron Litvak has been absolutely incredible. I cannot speak highly enough of the strong collaboration that we have in the county and at the state. Our representative Pamela Atkinson is on the state coronavirus task force, and from our governor down to our mayors, they are very closely involved and know what's happening with our homeless community and providing the support that we need. And so what we have done inside our facilities is we've done what we can with social distancing. We have moved tables apart. We are doing cleaning between each time somebody eats. We are putting barriers where needed in some of the facilities that don't have barriers between bunk beds. We put protective screens up. We've gotten a lot of masks donated, and we will continue to need a lot more masks. So please keep them coming. We just had a wonderful donation from our friends at Mark Miller Subaru, who brought down some N95 masks, which are so wonderful for our staff to be using. We are also having so many homemade cloth masks being made and brought into us. And again, we're going to need those. We expect that until there is a vaccine that is widespread, we are going to continue to see this virus in congregate settings. We are managing it now that we've gone through this first couple months of the crisis. We have a really good collaboration with the Salt Lake County Health Department. They've been tremendous. We have on-site testing happening within our facilities once a week. And we're doing screening of symptoms every single day with our staff and the people we serve. So ways that you can continue to help with the COVID-19 challenges is to continue to support in the way that you have. Keep an eye on our needs list. Keep donating those items that we need. And know and understand that this is a long-term prospect. We are going to need to make changes not only to the physical facilities to help prevent the spread, but we're going to need to make changes in our system. So one of the things that we've done with our partners in Salt Lake County and our other service provider agencies is opened a motel, a stay safe, stay home motel, so that individuals who are in a high risk category, so they're an older adult and or they have one of the high risk health conditions, chronic conditions that's been identified by the CDC as at high risk to COVID-19. And through our coordinated process in Salt Lake County, we are getting those individuals out of the congregate facilities. We're hoping to divert them before they ever come in to stay in a motel where they can do that social distancing that's so important to keep them safe. We know that individuals who are in those high-risk categories get much sicker and have higher death rates than other individuals, and we want to make sure that we have a way to divert those individuals from a congregate shelter facility. So all of this is going to continue to take a strong collaboration and years of work and planning, and it will mean a change to our system as a whole. And I just have to, again, bring up housing in response to this question about how people can help. From the federal government to the legislature down to your local county and city councils, we need to support affordable living in our communities, all of our communities. We've always known this, but stable housing is key to good health. And to keep people healthy, they need to be in their own homes. They need to be able to not be living in a congregate setting. They need to be able to take that deep breath and relax, that little bit of stress off their shoulders, so that they can take care of their families and work on the other things that they need to remain stable, including their health care. We need to have stable housing in our communities in order to have a healthy community. I think I diverted on that question a lot. So, okay, let me pull up another question. Okay, someone asked, what do you think of a homeless czar? Which I kind of giggled at a little bit because we went through an interesting time on this past legislative session where there was a proposal with a bill that would encompass a number of things around managing homelessness across the state of Utah. And there were a number of things in that bill that we felt very strongly were not good public policy. But the idea of a leader at the state level that is very directly tied to the governor and the lieutenant governor and is able to look across the state at what the needs are, look at the different funding sources, the different partners that are involved, and really help to put together a statewide strategic policy to, again, prevent more people from becoming homeless at all. When people do become homeless, making sure that's a very short period of time, and then really focusing on getting people into permanent housing. It does take that wider view. And we were very supportive of having someone in that type of a position, the type of a position where the governor and his team, his cabinet, and the legislature can all have someone they can turn to who can answer questions in that way on the statewide level. We think would be really tremendous. We know that our state legislature has invested a lot in the homelessness response system over the last few years. And tremendous thanks to our champions who were on Capitol Hill, Representative Elison, the majority leader, Francis Gibson, many of the individuals who were involved in funding for the new resource centers and for our new system. They also want to watch and make sure that things are continuing to improve and that the dollars that the state invests are having an impact. And so having someone in that role we think would be really, really helpful, and we would definitely support that for our state leadership. Okay, where am I on time? Okay, let's see. I've got a couple more questions, and then I'm going to go see if we have any new ones that have come up. How do we solve homelessness? That's another, I think that's also relates back to the housing comment. And I just, that made me think of one more thing around this. Like, people say, can you ever end homelessness? Well, we see a vision where we have a system that very quickly identifies anybody who's on the precipice of unstable housing and keeps them housed. So a system where people who need help know where to get it, where the resources that are providing those kind of help are really doing a proactive way in engaging with people and preventing homelessness to begin with. That is key. Those are all of our partners that are doing employment assistance, the food pantries, affordable transportation, affordable childcare. All of those things are so important. So in this vision, we have a system where people are identified and helped to avoid homelessness. And those who do fall into homelessness, we know right away that we have a coordinated system. So anywhere where someone is entering that space of experiencing homelessness, the system has a way to engage with them and go through our process of trying to divert that individual or family from ever having to come in. And then when they do an assessment and determine if they do need to come into how homelessness support, that they get connected right away to the best place, whether that's a location for families or individuals, a location that specializes in veterans, a location that has more services for older adults who have different kinds of needs, or someone who needs to go and wants to be connected with a substance use treatment facility. That's the system that we see, is that we have a system in place that has the capacity and has the reach to identify those who need the help, and that we can quickly get them engaged with that help and quickly get them into housing, and that we're measuring it, and that we have as many or more ways to help people into housing as we have people coming into housing. So we need more outreach than the number of people coming in. Hold on a second.
Have your attention, please. A fire has been reported in the building. A fire has been reported in the building. Please proceed to the stairway and exit the building. Do not use the elevators.
Hold on.
May I have your attention, please? May I have your attention, please? A fire has been reported in the building. A fire has been reported in the building. Please proceed to the stairway and exit the building. Do not use the elevators.
I'm going to have to pause for a second and see what's going on with the fire. I will be right back.
May I have your attention, please? May I have your attention, please? A fire has been reported in the building. A fire has been reported.
Okay, I'm back. We do have the fire alarm company doing some testing. So I want to assure you that I am safe and the building is safe and we do not have an actual fire. Okay, so where was I? Okay, I was talking about how do we end homelessness. So we do have, and I'm sorry, I just touched my face. You see how easy that is. We do have a vision where we have more ways to help people end their homelessness than we have people entering homelessness in our community. And that's what we're working towards. That's what the Salt Lake Valley Coalition to End Homelessness is working towards. That's what the state of Utah's homelessness coordinating committee is working on. Okay, we've got another question. We have a question from D. How can the community help with your mission to end homelessness? And we appreciate that question. It's so important to have our community involved. If you live in an area near a homeless resource center, please get involved. Ensure that we're part of the neighborhood, that we know if there's any concerns from community members, that we know if there's anything that you have questions, or if you want to come on site and help. We would definitely welcome that. And most importantly, the best way to stay involved is to check our website, to like our Facebook page, to follow us on Twitter and Instagram, and really just stay in touch so you know and understand what the needs are. And you can speak with your elected officials about those needs and what you're seeing in your community and how they can help. And we can provide information for you on that. Let's see. So we had a question from Liz about, during COVID, are there ways to volunteer? We have most of our volunteer opportunities are on hold. We are looking now at ways to bring people back in. The biggest way that our volunteers have transitioned during COVID is to do a drive, a local community drive, either making masks or gathering hand sanitizer, or looking at what any of our top needs are and bringing those into one of our facilities, and then helping with the meals. And there's information on our website about the meals here at the Men's Resource Center. We serve meals 3 times a day. And so we have ways that people can donate some food for those efforts right now. When we reopen to volunteers, you can come on site and help serve the meals here at the Men's Resource Center. And then in Midvale, the families have kitchens to make their own meals, but we also do dinners. And once we open back up, we have lots of opportunities for volunteers in all of our programs. Stay tuned. We're looking at some ways to start bringing some more volunteers into the mix in the next few weeks. Let's see, other questions. Please pop a question in if you have it into the feed, as I am looking to see what other questions I may have missed. Well, here's a question. Where does the Road Home operate from now? And we have the Road Home, formerly Travelers Aid Society, had been operating out of the downtown shelter since 1988. That was our agency headquarters, as well as the location where we provided shelter services. And when that facility opened down or closed down in November, and these other beautiful facilities opened, it also displaced our headquarters. And so we have about 75 staff who are on our administrative teams, our development and accounting teams and technology teams, as well as about 50 of those are our housing teams. So our housing staff that do the housing navigation work, develop relationships with landlords, get to know all the rental subsidy programs, help people fill out applications, help coach people on looking for apartments, and provide open unit lists to folks, as well as the case managers that work with families and individuals and veterans once they're in housing, all needed a home. And so we purchased a building a few months ago on Main Street, which will be our housing administration and housing navigation and administration services center. And we are currently renovating that building. It's real close to our staff and guests over at Palmer Court. And we will be operating out of that building in the fall or late fall. And so we will let you know when that happens, and welcome you all to come and see us there. It'll be a great new location, very centrally located, not just to Palmer Court, but to the resource centers that are downtown and other of our service center partners that are downtown. And so it'll be easily accessed for our partners and the people who are working with our housing teams. Okay, let's see. How and where can we bring in cloth masks for donation? Thanks for that question, Kim. We have drop-off points at the Men's Resource Center in South Salt Lake, and at the Midvale Family Resource Center in Midvale. Both of those locations have a big sign that says drop off donations here. You can come in and just drop them off and not engage with our team at all, or you're welcome. Our team is welcome to come and help you unload your car and give you a receipt if you'd like that. The addresses for both of those locations are on our website. The Men's Resource Center is just off of 33rd South, about 1000 West, on 1000 West. And the Midvale Family Resource Center is about 7300 South, near the tracks and I-15. So we would love to take your donations at either of those locations. Okay, I've got a few minutes left. Let's see if I've got any other questions. Oh, my sister's on. Hi, Charmian. Okay, let's see. Other questions? So there's some questions that are particular, a little bit more detail about our services. And so let me tell a little bit more about our staff. So we have our staff here at the resource centers, our housing advocates work at the front desk 24/7, help keep people safe and connect them with basic information about housing. We have incredible staff of case managers and housing locators, housing staff on site at these facilities. They're also on site at the other resource centers that are operated by our partner agencies. Really important to have a community view on what housing is available and what resources and rental assistance is available. And so our staff are at all these locations to make sure that everybody has equal access to the knowledge and equal access to the resources that are available in the housing realm. Once people move into housing, it depends on what their needs are. All of us who provide homeless services really try and tailor the needs to the individual. It also depends on dollars and resources available. We do have, at the Road Home, as I said, operates a rapid rehousing program, and that is a way to quickly connect people with housing. We have some dollars we can use to help pay off some housing barriers. So if someone has a debt that they owe to the utility company and they can't get their power turned on, we can help pay down that debt so that they can move in and open up a new utility for that new place. We can help pay some back rent that might be due. We can help someone mitigate evictions that might be on their record and help them talk with landlords about what was happening and how they're going to be a good tenant in the days ahead. And those staff work really closely on an individual basis to figure out where is the best place, where location-wise is the best place, and what kind of unit is best for that family or individual. We might have a family who has a child in a special program at a school. It's really important that we have them move to a place where they can have easy access to that school. Childcare is another huge need, affordable childcare with flexible hours for our guests who work all different kinds of shifts. It's an incredible need in our community, and there is some assistance through the Department of Workforce Services to help with that, but there's still challenges in getting connected. So we want to make sure that the family or individual moves to a place that's going to work for them and is affordable, and then provide the supportive services that we can. So our case manager, if we have a family moving out, we'll make sure that that family knows that we've connected with the school district, and the kids either can stay in the school that they were or get transferred, depending on what the parents in that family want. We'll connect them and talk with them about childcare needs and help them find an affordable childcare that they can get to. A Head Start program, which is wonderful, that they can get to for their children. Food assistance. We want to make sure that any resource that a family needs, we can help them get connected connected to help them remain stable so that they can use the money that they need to pay their rent for their rent each month. And so if they need some food assistance and there's a food pantry that they can access to get some help for that and not have to spend some money on food and instead on rent, we want to make sure we can have those connections. And so with our rapid rehousing program, we generally work with the families just for a couple of months. There's an ability to work with families for a longer period of time. We want the family to remain stable, and that program is very successful with more than 80% of those families staying quite stable for years after they move out of homelessness through that program. But there is often times where the dollars do run out and we don't have additional rental assistance or ability to continue case managing someone for many, many years. So we work with our partners. If we can get that family connected with an employment counselor at the Department of Workforce Services or a housing stability case manager with Utah Community Action, any of those other organizations that really provide that core support in the community, that's what our goal is. And then for families and individuals who have been homeless for a long time and have other kinds of disabling conditions or need assistance for many, many years, they will move into one of our permanent supportive housing programs. And in those programs, like Palmer Court, or some are also scattered site throughout the community, they'll be work with our case managers for years, many, many years, as long as they need to. And our case managers will make sure they also work with other supportive services in the community to help them meet their needs. I want to just mention one more piece of where the road home is coming from in the work that we do. And we have a number of guiding principles. We have some core values that we hold very, very dear around compassion and safety and equal access and equal treatment. But an overriding best practice that we've adopted a number of years ago now is that we want to ensure we're providing trauma-informed services throughout all of our programs. And what that means is that all of our staff are trained and understand what causes people to go through trauma, what trauma looks like, how it affects individuals and families, understand that people who are experiencing homelessness have gone through trauma, different levels of trauma to be sure, but many people have gone through some very traumatic experiences, come from unsafe situations, experienced tragedies in their life. And so how that can manifest itself in how someone engages with our team can come across as in a way that can be quite challenging. And coming from a trauma-informed perspective, we do not want to be in a power relationship with an individual or a guest. We want them to feel empowered. We want them to walk away from every conversation that they have with one of our team feeling stronger, feeling safer, feeling more hopeful, and knowing what they want and need to do next. And that's our overriding goal. It's an ongoing process. It requires continual training with our team. We work with other partners across the United States on these issues. We have just an incredibly talented group of staff, very knowledgeable and experienced, really staying on top of research, what is evidence-based, what is working in other communities that might work here. We always want to know what the data is telling us so that we can look throughout our programs, ensure that the dollars that we're investing is spent in the most effective way possible, that we're meeting the needs of that individual that's standing right across from us right now, but we're also meeting the needs of the community and helping to keep a safe community and helping to end and reduce homelessness on the community level. And it's really important for us to make sure that we always know what the data is telling us and that we're using that to improve our programs all the time, every day, every year. We want to make sure that if we're doing a program and it's not being as effective as we want, that we can dig in and understand why and pivot and then move forward and have more successful outcomes for the people that we serve. Hi, Allie. Good to hear from you. We have so many amazing staff that have also moved on to other communities and other agencies and still stay involved. And so our reach moves on. Okay, any other questions from folks? I've got just a couple of minutes left. Let's see. I don't see any. Oh, someone said, was asking about services for veterans in an earlier question that I missed. We do have services for veterans, and ending veteran homelessness has been a tremendous nationwide effort for a number of years. The Road Home serves as our community's lead agency on a grant that we get from the Veterans Administration called Supportive Services for Veteran Families. And that really is an opportunity for our veteran housing team to work closely with the VA, with the housing authorities. And we conduct a weekly meeting with all of those partners where we have really been able to develop a system to identify when anyone enters any of the homelessness service agencies or support agencies and identifies themselves as a veteran, that our team can immediately become connected, work with the VA, do an assessment to see what kind of benefits and resources that individual might have. And we often find that there are benefits that individual was not aware of or was not connected to. There are housing resources available for anyone really who has served in our armed forces, different kinds of housing depending on their needs and their eligibility. But we can always help a veteran, always, in our community. And we have just an incredible system in place for veterans. And I want everybody to know, if we do see veterans still coming into our system on a regular basis, but we are working with all the partners to ensure that they get the help they need and that they can end homelessness as quickly as possible. Okay, with that, I don't see any more questions. Yeah, we have. COVID-19 has definitely added to trauma in our community, and the people that we're serving, our staff and our community as a whole. In fact, we have done some recent work on organization-wide trauma and community-level trauma, and it's really important that all of us who are working in this field understand it, and that we all work together to provide trauma-informed services no matter where someone shows up for help. So I am going to wrap it up and thank you all for listening. Please continue to send questions in to any of our media and social outlets. We'll probably be doing more Facebook Live Q&As in the days ahead. And I really want to thank you all for taking part in our virtual one-by-one event. This has been a change for all of us in how we gain friends and partners and supporters in the community. And we appreciate you paying attention, passing on information. We have a couple more days left, and we have some incredible newer videos that are going to be coming online from some more of our team members. And those will go live every morning at 9 o'clock through the 21st, I believe. So stay tuned and watch our progress. Thanks you all for tuning in, and we'll see you soon.